Jeffrey Sachs is a well-known, renowned professor of economics, a leader in sustainable development, a senior UN advisor, a best-selling author and syndicated columnist, whose monthly newspaper columns appear in more than 100 countries. He's twice been named among Time magazine's 100 most influential world leaders, and he was called by the New York Times, quote, probably the most important economist in the world.
Hi, Jeff Sachs here, and thank you, Joanna, for allowing me to join this way. Sorry I had to be out of town for this very important meeting. You asked me to speak about the economics of healthy childhood and why it's a good investment. It's pretty obvious that investing in our children is without question, both morally and economically, if you want to phrase it that way, the most important investment that we possibly can make. It's unimaginable to think otherwise. What we know and what the great speakers that you've assembled will be saying all day is that to have a good life and a healthy adult life, one must have a good and healthful early development, from safe pregnancy and intrauterine development to infancy and early childhood development to decent education and life opportunities. As an economist, I could put all of this in dollars and cents terms. There's no question that human capital, as we call it, cognitive and physical development, is the most important productive asset of any society. There's no doubt that in the 21st century, if you don't have a decent education that builds on a healthful start of life, there's no chance of escaping poverty. There are no jobs for raw, sheer labor. We're in an age where skills and decent education are fundamental for being able to be part of the productive world economy. And we know from exactly people in the room today that if young children don't get a decent start, then already by age 4 or 5 or 6, their liabilities and disabilities from a bad start are so profound that they are likely to follow those children all the way through life. One could quantify all of this. Jim Heckman has brilliantly done so. Many, many studies of economic growth and development have brilliantly done so. I regard it as absolutely central, vital, in a way obvious, especially in our time. What we've learned is how powerful the early events in life are for the lifelong course. I think that we have some powerful agreement on these basic points. And in my capacity as special advisor to the United Nations on the Sustainable Development Goals, let me emphasize how much the SDGs are absolutely focused on this life cycle approach and on this basic message. SDG 3 on health calls for a healthy start of life and access for health services for mothers in pregnancy and for all of the phases of life, including from infancy onward. SDG 4 on education calls again for a life cycle approach with early childhood development, quality education at least through the secondary level, and skill development and adult education. SDG 5 on gender equality says that this is for girls as well as for boys. SDG 8, especially SDG 8.7, says decent work for all, opportunities for young people in the transition from school to work, and the end of child labor, all forms of child labor by the year 2025, and all what the SDGs call the worst forms of child labor immediately, including, of course, recruitment and use of child soldiers. That's 8.7. And SDG 16, specifically SDG 16.2, says to end abuse, exploitation, trafficking, and all forms of violence and torture of children. So we have a global agreement that, in my view, we can say implements the life cycle approach, recognizes the absolute multi-dimensional needs of children. I could have added, by the way, SDG 2, which calls for the end of hunger and decent nutrition for all, as another core component, and SDG 1, for that matter, which is to end extreme poverty, which, of course, is one of the key reasons that children lack the possibility of a good life when they're born into extreme deprivation. Well, we know that there are countless threats to healthy development, and thanks to many people in the room, we have an idea of their devastating effects, their epidemiology, their pathophysiology, if I can put it that way in most cases, to explain what happens. One can mention, and I would, poverty, of course, as a huge risk factor, violence, which is the topic of the meeting, the instability of the family. Research shows, again, not shockingly, that when it's a single parent household, the odds against the child are much greater. We now see, even when census tract wide, fathers are not present, the children do worse. So it's a social phenomenon, not only an immediate nuclear family phenomenon. We know that a dangerous physical environment, air pollution, that gives rise to asthma, lead poisoning, water pollution, the trauma of extreme events like typhoons and hurricanes can cause mental and physical disabilities for children, which again have a shadow over the entire life course. We know that lack of physical and cognitive stimulus in the years of rapid brain development can be devastating. And of course, we still have in the poorest countries well over half the kids not able to get a secondary education and often finishing school functionally illiterate and innumerate. Are we taking care of our children? No, we are not taking care of our children worldwide. We have all of those profound adverse effects on children felt in all societies: the poverty, the violence, the lack of quality education, the lack of access to health care, the dangerous physical environment. Those of you who know me know that I'm shocked by this, that we can't get our act together to protect our children. We have a lot of tools. We need what Joanna calls in the title a roadmap. That is, we need a policy framework. We need the investable resources. We need the delineation and designation of responsibilities across different sectors of government and society in order to get this right. There are some places that do relatively well. Johanna's Sweden is one of them. Again, those of you who know me know that I carry on endlessly about the social democratic model of Scandinavia as the world's best system, and our own U.S. competitive-oriented Ayn Rand libertarianism, a mental disorder, a perversion of decency, an immorality masquerading as a kind of morality of liberty, but it's nothing less than cruelty. In my view, it is not morality, and it is not responsibility to young children. But let me mention 6 areas of tools that we have that need to be part of the roadmap. First, of course, is social services. SDG 3, SDG 4, health and education available for every child, and the social work outreach, the community health workers, the community education workers, the community social workers, to help make sure that children, even in poor circumstances, are connected to public services. And let me emphasize public services, because the privatization of health and education in our society is dreadful. What it has meant is that poor kids basically don't stand a chance, and rich people are pulling up the drawbridge because they're funding their own health and education services and turning their back on public services. That's the American disease. Second, we need fiscal support for families. We need family support measures of the kind that we have systematically been slashing for the last 30 years. We need to give money to poor families so that they can raise their children better. This once was absolutely basic. It was attacked from the right. The so-called left in our country didn't want to fight the good fight. Bill Clinton ended welfare as we know it and basically ended welfare. And we have a lot of kids growing up in poverty who are extremely vulnerable. We need legal empowerment of the poor because our justice systems don't work, and people don't have access to the ability to defend their children's rights and their own rights against landlords and other abusers and those who hold them, trap them in trafficking or bonded labor, forced labor, even slave labor in many places, including our own society. We need a new strategy of community development. Again, I'm thinking back 50 years when we had community development ideas, but we abandoned them under Nixon, devastated them under Reagan, and never revived them. But we need community-based services for a healthful environment and to make sure that the community is working together to help raise its kids together. And the 6th area that I want to mention is positive education. The idea that our education system also has to help young people find meaning and values, also to develop their moral impulses and moral skills, as well as their physical and cognitive development. Finally, when we have looked at the questions of trafficking, modern slavery, violence, a lot of it has to do with sex trafficking and the violence against women that results from that. Again, I would refer to Johanna Sweden. Sweden developed a new model of policing against prostitution, basically going after those who pay and those who pimp, rather than against the prostitutes themselves, for whom there are social services and social support. And this so-called Swedish or Nordic model has been taken up by many countries around the world, and it has been shown to cut sharply the extent of prostitution and to help women who have been trafficked or forced through desperation into sex trade. And that also is something that we can learn in our country. All of this is to say that the concept of forging a well thought out, rigorous, local to national plan of action, not only to fight violence against young people, but to promote the health and well-being from pregnancy throughout the life cycle, is actually at the core of what governments have agreed. And we need to now put into practice these sustainable development goals. They are the world's globally agreed goals. They give us very powerful tools for doing exactly what you want to do, in that our governments are committed to fulfilling specific targets like SDG 16.2 against violence of children. They're committed to early childhood development. They're committed to ending gender inequality of girls and boys. They're committed to universal health coverage. My job is to do everything I can to bring important, crucial knowledge communities such as public health to bear, to hold our governments accountable and to help hold the rich and the powerful accountable. There's no shortage of resources to do what we need to do. I'll remind you that 2,208 billionaires on this year's Forbes list, 2,200 people, have a combined net worth of $9.1 trillion. For all my academic colleagues, you put that into an endowment, that's $450 billion a year. We have no shortage. That's just 2,000 people. And we need to mobilize the resources. We need to put into effect the smart practices, the best practices, and the knowledge of how important it is to treat our children decently and at all stages of their development. And I look forward to the conclusions of your deliberations and look forward to helping you to carry this agenda forward in the UN General Assembly and in countries all over the world. We are monitoring what governments are doing. With your help, we'll monitor them even more closely. We'll show them roadmaps, we'll show them ways forward, and we'll hold them accountable, as well as the world's richest people who need to stand up and contribute the financing to these solutions. Well, thanks a lot for the great meeting. Thanks for letting me join, and I very much look forward to the follow-up.